So I'm always the guy that spoils the party and brings people back together. And everybody's having engaged conversations, I hope stimulated by the just the excellent high quality of presentations we've had so far. Would like to have you gather back around the table and sit down. We have final two speakers on our day's agenda that I think are going to maintain the very high quality of standard that we've had so far during the day. So I'm very much looking forward to hearing their conversation. I know you will as well. So now we have been down the trail here on informed dissent, and we're going to be looking at the future of informed consent. So looking ahead is what the challenge is to our final two speakers. And again, I'll introduce them both, and we'll have them speak, and then we'll have our discussion period. So first we have Dr. Kenneth Sagg, who's the Jane Knight Lowe Professor of Medicine, the Division of Clinical Immunology and Rheumatology at the University of Alabama in Birmingham. His primary research interests are in epidemiology of osteoporosis and gout, and methods to translate evidence into practice, and the design of large pragmatic trials in rheumatic disease. He's the founding director of the Agency for Healthcare Research and Quality's Deep South Center for Education Research on Therapeutics, established in 1999. He also has a number of other research activities. He's been a teacher and a mentor to a number of students and fellows. He's published a whole bunch of peer-reviewed manuscripts and authored more than 100 reviews and editorials and book chapters and so forth, and has published a book, the Clinical Handbook on the Diagnosis and Management of Osteoporosis. So he's also active on the American College of Rheumatology Board of Directors, and a leader in the development of recommendations on the treatment of rheumatoid arthritis, and a member of the Council of the ACR Council on Health Care Economics. So good science, good teaching, and a lot of background. And we're going to also have on this panel Dr. Michael Pash-Orlow, who's no stranger to this group and has in a number of ways helped us with his wisdom and insight, and I'm glad to have him on this last panel as well. He's Associate Professor of Medicine, Boston University School of Medicine, a general internist, nationally recognized expert in the field of health literacy. Dr. Pash-Orlow's work has brought attention to the role of health literacy plays in racial and ethnic disparities, self-care for patients with chronic diseases, end-of-life decision-making, and the ethics of research with human subjects. And so we're very grateful to have both of you on this panel. Dr. Sagg, please.